Good afternoon, everyone. Thank you for joining us. To start, we acknowledge that the lands on which Memorial University's campuses are situated in the traditional territories of diverse Indigenous groups, and we acknowledge with respect the histories and cultures of the Beothuk, Mi'kmaq, Innu, and Inuit of this province. My name is Dr. Mikaela Murphy, and I'm a family medicine resident here at Memorial University. We are here today for a special announcement about the postgraduate medical education program. I would like to invite the Honourable Dr. Andrew Furey, Premier of Newfoundland and Labrador, to come forward and provide remarks on behalf of the provincial government.
Oh, thanks so much, Doctor. Good afternoon, and thank you everybody for coming. It always feels like I'm coming home to come to Memorial Medicine in the medical school. And I'm so pleased to be surrounded by pleasant colleagues and friends, frankly, that felt like family members for such a long time in the operating room and in the halls of this institution. I feel very fortunate to have a great working relationship with Dean Steele and Dr. Timmons, Minister Osborne, the postgraduate staff, undergraduate, everybody here at Memorial Medicine, really trying to create a vision for healthcare for the future of Newfoundland and Labrador. We're all working hard, of course, to address the shortage of physicians and other critical healthcare professionals in our system as we compete with jurisdictions around the country and, in fact, around the world. Just 2 months ago, we were here to announce that there were 5 new seats just added to Memorial's Medical School for undergraduate students from Newfoundland and Labrador for this fall. That's 5 additional doctors from right here at home who will likely practice here at the end of the day, hopefully. The decision to add seats to Newfoundlanders for Newfoundlanders and Labradorians was based on research that shows the retention rate for those who study medicine here is actually higher from those who travel here to study medicine. And we're ready to increase it by encouraging more and more people to study and pursue rewarding careers in medicine here in Newfoundland and Labrador. Some of my most cherished memories from my own career and training come from working in rural Newfoundland and Labrador. The people, the sense of adventure, the scenery, the dedication of the communities supporting everyone. Your government, with its partners, is pursuing creative solutions to attract and retain healthcare professionals as we continue to work to reimagine the healthcare system through the Health Accord NL. And that includes focusing not just on the delivery of service immediate, but on the social determinants of health, like housing and education, and making Newfoundland and Labrador a healthier province overall, while also delivering critical services to people in communities across the province in the best way possible. We are moving with a sense of urgency to reimagine the healthcare system that was designed in the 1960s. We know it will take a decade or more to see the biggest outcomes, but there is a solid plan in place and a spirit of collaboration to reimagine the healthcare system for the benefit of all Newfoundlanders and Labradorians. We know too well that we have to take action now, though, today, to address the most pressing issues, such as the recruitment of healthcare professionals across our province. Just like a patient, we need to triage, and we are. We've been bringing in a suite of financial incentives, things like increasing compensation rate for physicians covering ERs in smaller rural health centers, covering licensing fees for retired doctors to incentivize them to come back to practice, and giving $100,000 to help new family physicians set up shop. A couple of weeks ago, we launched an extraordinary everyday, a campaign aimed at recruiting and retaining healthcare professionals from across the country and around the world, heralding the value of working and raising a family in Newfoundland and Labrador, to those learning about us for the first time, or for those who just want to come home. And these are only some examples. The list of measures our government is taking to tackle the shortage of healthcare professionals is long and growing and will continue to grow. So today, I'm pleased to actually add to that list. We will be adding an international medical graduate stream in the Family Medicine Residency Program here at Memorial, aimed at Newfoundlanders and Labradorians who went to med school elsewhere but want to return home. We will add another 5 residency seats for those graduating each year starting in 2023-2024 academic year. It includes a 5-year return of service agreement as well. This is a pathway for international medical graduates to return to Canada to practice. Now, I'm sure we've all heard the stories about how challenging it can be to get an MD somewhere else and then return to Canada to practice and live. This is a significant way to make it easier for those graduates, for them to join us and practice medicine right here at home. Each stream in the Family Medicine Residency Program, which is celebrated around the world, offers a unique rural and remote learning environment specific to the communities that they serve. These extra seats are intended to help address the physician recruitment and retention challenges in Newfoundland and Labrador, particularly in the rural and remote areas. Every initiative we implement, every incentive we bring forward, every creative measure that we strategize about, our goal is always the same: attracting and keeping healthcare professionals here in Newfoundland and Labrador. Along with a number of other creative measures we've been announcing over the last few months, including incentives for registered nurses in the province, we hope that we will be able to turn the tide on the recruitment and retention issue that has been growing, if we're being honest, for decades. We don't have a single solution that we can implement to cure these challenges. No one does. There's no miracle drug, no magic bullet. Some of those solutions will take time. But together, these initiatives will lead to results, and they will show you all, not just everyone in this room, but everyone across the province, that we are listening and we understand the issue. We are working closely with stakeholders, and we thank them for all their input and their willingness to work together to meet these challenging times. Thank you.
Thank you, Premier Furey. We appreciate having you here today as the Premier and also as a Memorial alum. I would now like to invite the Honourable Tom Osborne, Minister of Health and Community Services, to come forward to provide remarks.
Well, thank you, and it's a pleasure to be here. Thank you, Premier. We recognize the challenges surrounding sustainability in primary health care services throughout our provinces. We've heard time and time again the difficulties in retaining doctors, specifically in rural areas. As the Premier indicated, we know that these challenges are not unique to Newfoundland and Labrador. Our government continues to work closely with our regional health authorities, the NLMA, Memorial, and all other stakeholders on how to best address the recruitment and retention issues right here in Newfoundland and Labrador. We remain dedicated to working collaboratively in our efforts to provide adequate health services to people throughout the province. For some time now, we have been employing a number of measures to try to find new and creative ways of delivering services, as well as finding solutions to help bring physicians to our province and encourage the ones already here to stay. We've adopted a collaborative team approach, opening new clinics, which include physicians, nurse practitioners, and other healthcare professionals, to ensure that you receive the right care from the right healthcare professionals at the right time. We launched 2 new pilot projects to attract more medical graduates to family practice. We've expanded virtual care, established provincial health professional recruitment and retention office with staff. We've added additional seats here at the medical school for undergraduate students from Newfoundland and Labrador. And we've increased the compensation rates for physicians in a number of our rural healthcare facilities. Today, we are very pleased with our announcement regarding 5 residency seats for international medical graduates. This is actually very big news, and anybody within the faculty understand how important this news is today. It is yet another measure that we hope will continue to help address our physician recruitment challenges. These new seats represent 5 more potential doctors per year who may choose to stay, live, and work in Newfoundland and Labrador. And I want to reiterate that our focus remains the continuous improvement of our healthcare system in conjunction with our stakeholders that support our health professionals and provide better health outcomes for the residents of our province. This is all in keeping with our government's commitment to change the delivery of healthcare in Newfoundland and Labrador for the better. Today's announcement is one more effort towards achieving that goal. Thank you, and I want specifically to thank the Premier for this initiative. He was the person who spearheaded this. Again, it is a very significant announcement.
Thank you, Minister Osborne. We appreciate having you, the Premier, and other government officials here today. Now I would like to invite Dr. Sohaib Al-Asaaed, Associate Dean of Postgraduate Medical Education here at Memorial University, to provide remarks on behalf of the Faculty of Medicine.
Thank you, Dr. Murphy, and good afternoon, everyone. I'd like to extend my welcome and my thanks to the Honourable Dr. Andrew Furey, the Premier of Newfoundland and Labrador, as well as the Minister of Health, the Honourable Tom Osborne. I'd also like to welcome you as invited guests and faculty members to the faculty on behalf of Dean Steele, who could not be here today. Today's announcement is certainly news to celebrate. It is certainly of great importance and value to the Faculty of Medicine and to the people of the province of Newfoundland and Labrador. It's especially important as an active and current healthcare practitioner. I see this day to day, and I see the immense amount of pressure being placed upon physicians, including my colleagues in family medicine. As the province's only Faculty of Medicine and medical education institution, Memorial University's Faculty of Medicine plays a huge role in helping support the needs of the province, including in the active recruitment and retention of physicians, both current and future. In particular, this announcement pertains to our family medicine program, which, under current excellent leadership and guidance, has excelled in producing, in particular, rural physicians. Over the past several years, and for several times, 9 in particular, we have been named as Canada's #1 program in terms of training and graduating medical doctors who are family physicians practicing in rural settings. This is unmatched by any other faculty in the country. The expansion of our family medicine program will provide an opportunity to give hands-on and excellent training to these physicians and experiences and exposure to our communities around the province. This will be open to Canadian citizens and permanent residents who want to come home. By increasing the number of family medicine seats, there will now be more opportunities for these individuals who've studied medicine elsewhere, as referenced by Premier Furey, who want to come home. And this allows them direct access to excellent training front and center. I'm going to take a moment just to describe why it is that we're harping on the family medicine piece and why we're talking so much about postgraduate training or residency training. So when a medical student completes their training and they earn their MD, they are not done their training. They have to complete residency training, and that training is in any number of specialties, including family medicine, and that currently takes 2 years. Every year, these medical students end up matching, that's how we reference it, into a family medicine program, typically of their choosing, but also of the program's choosing, into any program across the country. And the only ones who are currently eligible to match into residency training here in the province and here in our family medicine program are those who have graduated from another Canadian medical training institution. What we're doing now is we are opening the doors, literally, to international medical graduates to be able to apply for a seat competitively to enter residency training right off the bat. so they don't have to wait for whatever is left over if there's anything left over. And we are inviting these individuals to come home. This match happens through the Canadian Residency Matching Service. It is run and led by and organized by our Family Medicine Training Program under the leadership of Dr. Russell Daw. This match, completed through CARMS, happens once a year, and therefore these 5 additional positions above and beyond our current 35 positions out of 80 residency training seats will now be open, and these learners will be able to commence training as of July 1st. The entry and the matching process commences in October, and a decision will be made through the match sometime in the spring. We know that trainees who train in certain communities very early on tend to establish relationships and ties to the land, to the people, and tend to want to stay. And so this announcement is really, really big news, both for the faculty and for our province. On behalf of Memorial University, the Faculty of Medicine, and Dean Steele, I'd like to extend my many thanks to the Government of Newfoundland and Labrador for their commitment to advancing medical education as we work together to help meet the needs of the communities throughout our province. Thank you.
Thank you, Dr. Al-Asaaed. Your leadership and passion for medical education is inspiring. Prior to becoming a family medicine resident at Memorial, I completed my undergraduate medical studies at University College Cork in Ireland. Having spent 5 years away at medical school, I wanted to return home to Newfoundland and Labrador. I was so delighted residency spots went unfilled my year, and I had the opportunity to apply and was accepted at Memorial. Now I am able to learn to practice in my home province, in a program that offers me the perfect blend of rural and urban with a chance to pursue my interests. Matching to Canadian residency programs is especially competitive for international medical graduates. Up to now, IMGs were not able to apply to Memorial in the first round. This announcement will encourage more medical students to consider Memorial as their first choice for residency, attracting them to our province. I'm so glad more Canadians, including Newfoundlanders and Labradorians like myself, will now be able to continue their training in our province. Thank you very much. Now we will conclude the formal portion of this announcement, and I would like to invite Premier Furey, Minister Osborne, and Dr. Al-Asaaed to come forward for a photo. We will be available for questions and interviews afterwards.